mesh related complications after hernia operation. So let us talk about mesh infection. My name is Dr. Dattaram. I'm a consultant surgical gastroenterologist and a laparoscopic surgeon practicing in Hyderabad. One of the common concerns patients have is about the problems related to the mesh. Mesh infection. Mesh is nothing but a polymer based substance. So it's a thin sheet of polymer. Commonly used is a polypropylene or a polyester mesh. So this is an integral part of a hernia operation. The rationale of using a mesh is to reduce the risk of recurrence. Once you place a mesh, it stays in the body for the rest of your life. How does a mesh help? The mesh gets integrated into the tissues and it helps to form a strong collagen or a fibrous tissue which reduces the risk of having a recurrence. The strength to the hernia repair is given by the mesh. Just imagine a reinforced concrete. So the usage of a mesh makes tissues very strong and reduces the risk of having a recurrence. Mesh is not your body part, it's a foreign substance. So inherently there is a small chance of having a mesh infection. The incidence is very low. Literature incidence of mesh infection is as low as less than 0.5%. The last 5 years, in hundreds of hernia operations I have performed, both open and laparoscopic, I haven't had a single case of mesh infection. A lot of precautions are taken even before the mesh is placed into the body. If you have any comorbidities like diabetes mellitus or using immunosuppressive drugs, all these things are optimized even before the operation, especially control of sugars. Specifically during the surgery, a lot of precautions are taken. For example, the hair in the region of the operation is removed just before the operation. A thorough antiseptic scrub wash is given to the area of the surgery. A prophylactic antibiotic is given intravenous even before the skin incision is made. The mesh comes in a highly sterilized pack which is opened just before the mesh is placed into the body. All these precautions are taken to prevent a mesh infection. However, as I mentioned before, there is a small inherent chance of having a mesh infection, not only for a mesh, even if you place an intraocular lens or a heart valve or a prosthesis into the joint for a knee replacement. So all these foreign substances which are placed into the body carry a small risk of infection. I would like to emphasize the fact that the benefits of using a mesh are far more than the small risk of complications what are associated with it. The risk of having a complication, especially mesh infection, is very low, and using a mesh for hernia operation is absolutely safe.